I think there's and what I've heard from multiple sources is there's a transition where it's less efficient and it takes longer time. But I think that now we've been in it a year and a half, maybe 2 years, and it's certainly seen advantages. I think the real advantage that we see is we're a big group with multiple locations, so a patient can be seen somewhere else, have x-rays, and they show up and their records are with them. I remember the days when we spent all of our efforts making sure that the charts and the x-rays came with the patients. We also can call colleagues at different locations, ask them to look at the x-ray and talk about patients, which is really, really helpful. Digital radiography really helps a lot in just collaboration and asking about what to do with patients and how to treat certain patients.
Well, we kind of stuck our toe in it about 3 or 4 years ago, and started out with it very slowly, but found that that we really needed to get all our doctors on board with it. It was kind of a hard thing. I would say that I was probably one of the slower ones to come along because I was used to paper medical records, and so it was. But once I got into it and using it, it's very nice. I mean, you can pull up patients' old records, old operative notes very, very quickly. Just a click on your computer, you'll see, problems they had from many years ago. You can pull up their x-rays very quickly. You can get reports from other doctors very quickly. So it's really speeded or made us more efficient and sped up the care that we're giving to patients. So we're glad we're into it. It was kind of a hard process. It is kind of very expensive, but I would say get into it because you're going to have to. If you don't, then there's going to be a penalty.
We actually started with our electronic health record in 2002, so we've been at it for quite some time. We've been through many versions of the electronic medical record that we have, and we've just completed our latest conversion back in April. EMRs are something that are constantly in evolution, constantly responding to both the practical day-to-day needs that our physicians have for efficiency and operational support, but also for meeting documentation guidelines, which are, as we all know, are constantly evolving. With the new meaningful use criteria finally being defined last month, it's given us an opportunity to refocus on those areas that we're going to have to further enhance with our EMR. But we feel confident that we're going to be able to meet meaningful use by October of next year, which is the first deadline for that. Our EMR has been helpful not just from the clinical side, but also in terms of our quality maintenance program, because it allows us to document that when we have built consensus around a particular guideline or treatment path, we're able to show and document that our physicians are in fact meeting those targets and report back to them through our data warehouse how they're doing and where there may be areas for improvement. So really the EMR is a multifunctional tool for us and has become increasingly important over time for both quality, compliance, and for operations and clinical practice.
I think it's interesting. If you asked, I think some of our junior partners compared to some of our more senior partners, their trepidation or their level of enthusiasm for entering electronic medical records, I think you get two very different answers probably. I think for me personally, most of my training involved electronic medical records in some form in different hospital systems, so we had kind of been through seeing the strengths and weaknesses of different systems. So when we implemented ours, for me personally, it was a very seamless transition. So I didn't have a lot of apprehension heading in, although my biggest concerns are more with abrupt system failure and lack of inability to immediately access any records. So for probably the first 6 months, and still frequently now, I will just go ahead and have a printed copy of at least the most recent note in the event of large system failure.
It's interesting because recently we've had changes regarding our durable medical equipment that we administer to patients, and depending on their insurance, some of them are being required to pay for that particular device up front. And so that kind of changes our perspective on which equipment we would consider using or giving a patient based on their ability to pay. And so certainly that affects decisions that we make as a result.
I think especially in the beginning while you're learning the system, have your last note, your most recent note printed off, so at least in the event that it goes wrong, you've got something to fall back on. You have some recollection of the patients. You're not walking in blind trying to figure out what's wrong with them. But in terms of overall, it has run very well for us, and I've been very pleased with it.
Like with anything else, it takes something of a learning curve. And so I would say to that apprehensive physician that it's certainly understandable. I think a lot of us dealt with that. Fortunately, when I was doing my training, I had a mix of certain practices that were primarily electronic medical record based and others that were still doing handwritten charts. So I had my exposure to that early on in my training. I can say that the ability to dictate patient encounters maximizes efficiency. If I had a chart everything at the end of the day every day, it would make for a much longer work day. And I think ultimately, while most of us do complain about having charts to dictate at the end of the day, ultimately I think it improves clinician satisfaction to be able to do that. Also, I think it makes accessibility a lot easier. Certainly everything has its disadvantages. If the system goes down or if the EMR isn't accessible for one reason or another, then everything kind of comes to a grinding halt. And so that's potentially a disadvantage, whereas in a paper chart you can just look up a note. But I think that those situations are few and far between. So it's nice being able to have immediate access and look up older notes and things of that nature just with a click.
Electronic medical records is something a lot of people are afraid of, and they're afraid of it for two reasons. One is there's a large capital cost up front for a lot of people, and two, it's a disruption of the practice to change from paper-based charts to electronic medical records. The fact is that if you're going to continue to participate in government payers and eventually with private payers, they're going to require that we use them. And starting in 2015, you're going to start to get a penalty if you don't do it. The reality is it makes your practice very efficient if you use it fully. And so there's a real opportunity there. It is a hurdle to get over, but honestly, they have evolved. When we started in 2002, it was not easy. But they've evolved to the point where they're quite user-friendly and they're easy to use. And there's also been consolidation in the medical record market so that there are fewer players out there, but the ones that are out there are pretty tried and true and are probably going to be around for the long term. So concerns that you may get up on an EMR that won't be useful or that will go away have pretty much gone away. And so now's a really good time to get in that and make use of it before the penalties kick in. The one piece of advice I would say is if you're going to do it, jump in with both feet. Because the worst thing you can do is to run dual systems indefinitely. And the tendency is for half the practice to get on or two-thirds to get on, but the stragglers to really resist it and say, I'm going to keep my records on paper and let the other guys do the EMR. That costs you twice as much to run dual systems, and it makes it a compliance issue and an operational issue. So as hard as it is, at some point you got to just shred the charts and move forward. And our physicians were pleasantly surprised at how that transition went and are now enthusiastic and supporters of the electronic health record. One final point regarding the capital costs. Smaller practices are finding it very hard to find the money for these capital costs, particularly when the physicians are older and are not sure they're going to get their return on that. It offers an opportunity to pair up with other practices, and I would encourage folks in smaller practices to look at opportunities to link up with larger practices. We in fact are busily working on ways to allow other smaller practices to get the benefit of our capital investment in infrastructure. Always easier to add a few more people onto an existing system than to start it from scratch. So I would encourage people not to forget that option out there as opposed to building it all in-house on your own.
Well, as I tell my staff, computers aren't going to go away. So, and it's a mandate, so you might as well just accept it and do it. And there is a learning curve, and it is absolutely less efficient the first 3 months or 6 months. But then after that, I think the time that we spend now is probably less than it was before. There's certainly aspects of a paper chart that are more efficient than electronic medical record. But I think all in all, the electronic medical record is more efficient, and if you look at the end of the day, saves us time, especially with all the documentation and the Medicare requirements and how we have to document our records. A lot of that can be automated and makes it just easier to comply with all government regulations.